A 33-year-old man presents to the emergency department with a 2-hour history of palpitations. He has no past medical history. He denies chest pain, shortness of breath or loss of consciousness. He drinks a moderate amount of alcohol and smokes 10 cigarettes a day. On examination, you note equal air entry with normal chest auscultation. You do not detect any murmurs. His observations are recorded as heart rate 170 beats per minute, respiratory rate 20 breaths per minute, blood pressure 143 by 95 mmHg, GCS 15 by 15. An ECG is performed at triage which shows a regular, narrow complex tachycardia. What would your first-line treatment be in this patient? Options are A. Adenosine 6 mg, B. Synchronized DC cardioversion, C. Vagal maneuvers, D. Amiodarone 300 mg, E. Atropine 500 micrograms. Answer is C. Vagal maneuvers. The first step in treatment of regular narrow complex tachycardias is to attempt vagal maneuvers, carotid sinus massage or Valsalva maneuver. If the tachyarrhythmia persists, adenosine 6 mg IV should be given as a rapid bolus using a large cannula and a large vein. If there is no response, that is no transient slowing or termination of the tachyarrhythmia, to adenosine 6 mg IV, a 12 mg IV bolus should be given, and if there is no response, one further 18 mg IV bolus given, max 36 mg. A 78-year-old man presents to the emergency department after recording his own blood pressure at home. He is concerned because he has never seen the top number so high. What is the definition of hypertensive urgency? A. 170 by 110 mmHg, B. 180 by 120 mmHg, C. 190 by 120 mmHg, D. 200 by 130 mmHg, E. 210 by 130 mmHg. Answer is B. 180 by 120 mmHg. Hypertensive urgency is defined as a BP above 180 by 120 mmHg, but the patient is stable and there is no organ dysfunction. A 39-year-old man presents to the emergency department with a 3-hour history of central chest pain. He is a current smoker and has a strong family history of ischemic heart disease. His ECG shows horizontal ST depression in leads V1 to V3, with associated prominent upright T waves. Serial troponin assays are positive. What is the most likely diagnosis? Options are A. Unstable angina, B. Wellens syndrome, C. Posterior cent elevation myocardial infarction, STEMI, D. Aortic dissection, E. Anterolateral cent elevation myocardial infarction, STEMI. Answer is C. Posterior ST elevation myocardial infarction. Horizontal ST depression in leads V1 to V3 with upright T waves raises the suspicion of posterior STEMI. This could be confirmed with a posterior ECG, V7 to V9. You would expect ST elevation in these leads.